Okay, the first thing you want to do is make sure that you have access to all personal and protective equipment, called PPE. At your site, the requirements may vary. At Teiko, we have lab coat, goggles, and gloves, and those are used for drawing blood. The next thing you want to do is make sure you have access to a -80 freezer or dry ice. Okay, we're going to be showing you the contents of the box. You can see we're going to open it, and the first thing to do is inspect the contents and what's in here. We're going to take out each item one at a time. The first tube is a green top tube that we're going to draw blood into. The second is a transfer pipette. The third is an orange top, also known as coroning tube, which also has a buffer preloaded. And now we have a specimen collection bag, which we're going to return the sample in, and an absorbent pad just in case there's any spillage. And these are all the contents of the kit. And the first part of getting your patient ready is getting the tourniquet and vial. So here's the tourniquet. We're going to put this on. Make sure you've got your green top tubes, your butterfly needles, your connector, and your alcohol prep pads. Now you're ready to draw. Now that the sample has been collected, I'm going to transfer the blood into the orange top tube, and we're going to show you how that works step by step. So first, unpackage the rest of the kit. And now you're going to unscrew the top of the orange top tube. Then unscrew the top of the green top tube. And then use a transfer or micropipette to carefully draw up 2 mL of blood. And once you have this 2 mL of blood, you're going to gently pipette into the orange top tube, up and down, several times to make sure that the sample is well mixed. Discard that. Then you're going to put the cap back on both tubes, the orange top and green top respectively. You're going to discard the green top tube. Now for the orange top tube, we want to gently invert by hand 10 times. And this process is important to make sure that the sample is well mixed. Make sure that before you have the sample set, you have a 10-minute timer either on your phone or somewhere nearby ready to go. The sample must be held for exactly 10 minutes. More or less may corrupt the sample or damage its integrity. Okay, so 10 minutes have elapsed, and now it's time to move on to the final stage of taking this blood sample and carefully putting it in dry ice. And at this point, you're done. Now it's time to call FedEx or use your shipping instructions as needed to get a pickup. Thanks for watching our video.